What is up, people? Jared here with Wine of the Nation's Rage. This is going to be a video about my third and hopefully final knee surgery. I have hope and I believe that this is going to take care of the problem. Tomorrow I'm going to be having ACL reconstructive surgery. Like I said, my third surgery. And this is going to be, from what I hear, the most painful by far of all three of the surgeries. It's the biggest deal. It's going to take the longest time to recuperate from. And so I just want to say that I'm a little nervous going into this. And so I'm going to make a video about it. Not that it will make me feel any better, but just, just because it's real life, it's my life, and I broadcast myself on my YouTube channel. And for those of you that don't know, maybe you are curious by chance and you just want to see what this is all about. So I put some stuff together and I'm going to show you just what I'm in store for. And this will be the first part of this video, and I'll explain that I'll probably do the same thing that I did last time I went into knee surgery a couple months ago. Like I said, I've had 3 knee surgeries. If you watch any of my vlogs or anything, you're sick of me showing you my knee, but I'll just do it one more time for the sake of this video. But I've had 3 knee surgeries. I've had 1 open surgery last summer. A little over a year ago, I had open surgery. Meniscectomy. They took out my medial meniscus. Okay, and then a couple months ago they did an arthroscopic surgery. They went in and they took out additional cartilage and scar tissue from the first surgery that didn't go as planned. So I've been waiting to get better for over a year now, and not until just recently, as in a few months ago, did they actually realize when they did the second surgery that I have a torn ACL, and that's why my knee's not getting better. Okay, so I'm going to show you a picture here of the anatomy of the knee, the right knee, just some basic anatomy, and I'll explain to you that during my first surgery and second surgery they were taking out my medial meniscus, so I no longer have this here. This is gone now inside of my knee. Alright, this is what's torn, the anterior cruciate ligament, torn. Okay, so what they have to do in an ACL reconstruction is they're going to have to go in my knee, they're going to have to remove this. Okay, not really a big deal. That can be done arthroscopically, meaning that they don't have to put big incisions in my knee or anything like that to get that out of there. And from what I understand, they can do this entire reconstruction without making big incisions and doing open surgery. They can do it arthroscopically. So that's a good thing. Alright? But I'll go ahead and I'll show you this picture. It's kind of small. I'm sorry about that. But this is basically, this is a torn ACL. I think this is in the left knee. Could be in the right knee, actually. Yeah, it might be in the right knee. Anyway, that's not important. But basically, that's what happens when your ACL tears. It just tears like that. From what my doctor said is that my knee is beyond this point. However, that it's been so long that it's been torn for. It's been torn for well over a year. I was first injured on June 6, 2014. So it's been well over a year since this has happened. And so anyway, to make a long story short, this is what they're going to be doing tomorrow. Now I'll go ahead and show you, or try to explain, that normally in a lot of cases what they'll do is they'll take a graft because they basically have to repair or they basically have to replace the entire ligament once it's torn. They have to take the old one out, they have to put something new in to replace it. And a lot of times they'll just take a graft, what's called an autograft. They'll take a piece of you and put it in the ligament's place. Okay, the torn ligament, they'll just take another part of you. Like for instance here, what they've done is they've taken a part off of the patellar tendon, which is the tendon that holds your kneecap in place. They'll take that and they'll run it back through and put it in the place of your torn ACL. Alright, another option that they have is they'll take a graft from your hamstring and do the same thing. Alright, and the third option, which I don't have any pictures of this, I don't think you want to see any pictures of this. The third option, the option that I'm going to go with, is they're not going to take anything out of me and put it in the place of my ACL. They're actually going to take it from a cadaver, a body, a dead body. So yeah, they're going to be taking a part of someone's dead body and putting it in my knee, in the place of the ACL. And I got a little picture here, just a little computerized, or made on a computer picture. Basically, they'll make a small incision here. They'll take out the torn ACL just to give you an idea of how that goes. Not really a big deal. They've already taken my meniscus out, so they could take that out as well. That's not a big deal. But this is a big deal. This is what's gonna cause so much pain, so many problems, is that basically it's what they have to do to get that new replacement ACL in there. As you can see, they run it through your tibia up through your femur. Okay, and they use, which they have, I'm sure they have a fancy medical term to call this tool, but basically all it is, it's a drill. Okay, they have to drill through your bones to get this new ligament in place. Just to give you an idea, okay, of what they have to do. They actually have to drill through your bones to put this new piece in place. And yeah, I know that's a little graphic, but just to give you an idea, yes, it's actually a drill. They might call it something else, but it's actually a drill. They just drill up through your tibia, through your femur, and then when it's all said and done, I'll just go back to this picture here. They have to have something to hold it in place, so what they'll actually do is they'll take medical screws to hold it in place. Ouch. Okay, that's all I have to say. Ouch. So yeah, this is what I'm going to be having done tomorrow. Now, that's a big deal, and it takes a while for them to do this, by the way. On average, from what I hear, it takes about 2 hours. So this is going to be the most major surgery I've had up to this point in my lifetime. And there's always a risk with when you're using anesthetics. The other 2 knee surgeries I had, I was under for about 20 minutes. As I said, 2 hours. Being under for 2 hours, obviously that creates a risk for blood clotting and stuff like that. So I've actually had some people come out to my house and drop some stuff off, like this here. These are compression straps, I guess you would call them, and it's just like just like when you get your blood pressure taken and stuff at the doctor's office, your pulse and everything else, they put the little strap on your arm. They pump it up with air. This does the same thing. And what that does is it's supposed to prevent blood clotting. So I'm going to be using those around the clock, as well as another device that was dropped off yesterday. This is known as a continuous passive motion machine. Okay, that's what the CPM stands for. And what you do is you put your leg in there, you strap it down, and what it does is it automatically creates flexion and extension in your leg so that you don't have to. Which obviously you're going to be in so much pain you're not going to want to move your leg. So this will do it for you, which is going to be painful, but not nearly as painful as if you're trying to do it yourself. And the purpose of this is to prevent your leg from becoming stiff, your whole knee joint from becoming stiff and stiffening up, because that'll be a big problem, obviously, in getting better and recovering from this major surgery. You don't want your joint to get stiff. It's going to happen. I mean, from what I understand, it's going to happen inevitably anyway, but it could be not so bad or it can be horrible. And if it gets to that point where it's that horrible, you have no range of motion whatsoever, it's going to take a lot longer for you to recover. And they may even have to go back in and do an additional operation to keep to get rid of the scar tissue and whatever else is causing your joint to stiffen up. It's just the way that your body heals. If you are just lying around, getting better, not moving that joint, that critical movement that you need, then you're going to get scar tissue, you're going to have all these problems, and you're going to need an additional operation. And from what I understand, this operation is over $30,000. It's costing the insurance company over $30,000, which I'm not paying for because I'm on workers' comp. This injury happened at work. So, yeah, just to give you an idea of what I'm in for, this will be happening, this operation will be happening in less than 24 hours. And what I'll do, like I said before, is I'm breaking it up into different video clips. And what I'll probably do tomorrow is similar to the last surgery that I had. I'll probably film a little bit on the ride up there to the hospital and maybe do a little short clip of when I'm waiting to have surgery, and then the post-op part, as long as I'm not in too much pain. Now, there's a good possibility that when I come out of surgery, I'm going to be in shock, and I'm not going to want to film. You know, I'm going to be in a lot of pain. So I'm trying to prepare myself for that. If that's the case, if that happens, then I will get back with you at a later time, i.e. after I get some drugs in my body to dull the pain down that I'm going to be in tomorrow. And I'm pretty nervous, you guys. Like I said, this is the biggest surgery I've ever had. It's the biggest deal as far as the procedure, what they have to do, you know, drilling into my bones and stuff like that. I've never broken a single bone in my body, so I'm not really familiar with that kind of pain. I'm familiar with tissue pain, soft tissue pain, muscle pain, all that stuff, but not really too much bone pain. So I'm trying to prepare myself for that. So wish me luck, you guys, and I'll see you tomorrow. I'm so nervous, you guys. I'm so nervous. I'll see you later. Is that an Escalade hearse? That is totally an Escalade hearse right there. So, it's D-Day. Well, not D-Day, but it's the day of.
D-Day.
We're on the way. I got my compression straps. I got my crutches in the back that you can't see. I even got I got my beautiful wife to escort me and take care of me. And I've even got a prayer cloth. So I'm not gonna let the nervousness overcome me. And I'm really thirsty right now, but there's nothing I can do about it. And I wanted to clarify something. If you watched the video clip medley 3 and you heard me if you saw the scene where I was in the car talking about catheters.
So, catheters, aren't those just a bundle of unconscious joy?
I just wanted to clarify some things. Turns out that not every time you go under for surgery do they use a catheter. I was told by one of the nurses at DeKalb Medical that that's only during surgeries that are longer, for longer procedures. So I don't know if the procedure I'm having today would qualify. I don't even know if I want to ask.
I think you have to sign something when you get it.
Do you have to sign something?
I think so.
Okay.
Because it's an invasive, well, it's considered invasive because it's going in. But maybe not. But I think you do.
So I guess I'll know if I have to sign something or not.
I don't know a whole lot. I'm still in school. I'm learning, is what I'm saying.
Another thing I wanted to say is that, I know I talked about it some yesterday, but thankfully my doctor is sympathetic somewhat for his patients. I'll give you 2 examples as to why I would say that exactly in that way. But first of all, it's because instead of taking a graft out of my leg, he's gonna use a graft from a cadaver to repair or replace this ACL. So that's sympathetic. But the reason why I say somewhat is because I was told that if I didn't use that continuous passive motion machine I showed you for at least 6 hours a day, and it had no effect on my leg and whether or not my leg stiffened up or not. Basically, I was told that if my leg was stiff, then Dr. Hovey would personally adjust it himself with his own force. And so I know it would be under a condition that it would be for your own good if he were to do that, but apparently he's done that in the past, and I really want to avoid that, so I'm going to be using that machine religiously to keep that from happening, because anytime pressure is applied like that, like whenever I had physical therapy last year after my first surgery and I had a lot of scar tissue keeping me from getting my range of motion, my physical therapist basically said that she was going to have to manually adjust my leg to get my range of motion back, meaning putting pressure on the joint to get the scar tissue to break up. So literally just forcing it to break, and I don't want that to happen. That sounds extremely painful, so I'm going to avoid that at all costs. But yeah, I just wanted to clarify that and maybe get a little bit of footage of Highway 212 here, which you've seen dozens of times in my videos.
Whenever I was doing my physical therapy rotation at the hospital, I got there like 2 hours early. I had a lot of time to talk to the physical therapist there. And he was telling me that, especially with cadaver grafts and ACL surgery, patient starts feeling better around week 8. He said that's when you have to be very, very, very careful. Because he said it takes a while for the blood supply to completely pick up, which doesn't make sense to me at all. But this is what he said, and I'm sure he knows what he's talking about. He said that you have to be careful because it takes a while for the blood supply to completely consume that tissue. So it's really easy to tear again. But he said around week 8 is when you're going to be feeling good. Like you're going to be feeling, you know, back to your normal self. Like you're able to get up and move around.
Yeah, like I was saying, well over $30,000 for this surgery, and that's just for the hospital side of it. That doesn't include all the medical equipment that's being leased out to us.
Physical therapy.
The physical therapy, the medication, and all that stuff. It's a very expensive procedure, and my 3rd one at that.
And the crazy thing is if they had just let us find a good doctor to start with, and to get somebody that knew what they were doing to look at your knee, and somebody that was going to do it right the first time, we could have been done with them like nearly a year ago. Because I think that any other insurance company would fight this if they had went about it correctly, you know? But I think they know that they messed up. What's that car squealing?
We're very early. We're like an hour early. Our car squeaks like that because we need a new suspension. It sounds like there's a canary in the back of our SUV every time we hit a bump.
Not the worst sound.
Either that or it sounds like we've got a Pennsylvania suspension. Just think
You
of
have to tell me where to turn.
a heavy set man in a Cadillac from up north. There's a light up here, you want to turn right, North Decatur Road. North
Right?
Decatur Road. Yeah. It's gonna be on the left.
Oh, right. Well, I was trying to, because I know that the CAP Crisis Center is right next to the hospital, and I was thinking it's on the left, but after you turn right. It did.
Did I mention I can't eat or drink anything?
That doesn't look good.
Well, anything looks good at this point, because I'm hungry. My stomach hurts because I haven't eaten. But at least, hey, if you saw the last surgery video, at least I'm not sick this time. At least my tonsils aren't swollen beyond recognition. So I'm thankful for that. My throat is dry, but my tonsils are okay. Yeah, I've already gotten all this stuff. I got all this stuff, the first surgery video that I did. My doctor's office is right there. Remember how to get there?
Is this where it is?
Mm-hmm. Yeah, it's not the main hospital down there. It is the Dr. I messed up this time. Dr. Bobby Bailey Tower. And then it just, look at that pothole. Come on, DeKalb County. Get it together. Trick or right. I'll tell you a story about last time I came here for the pre-op. So, As you know, I just had to fix both of our doors on our truck.
I know.
And before that, neither of the front doors would open on the outside. So I had to come here on my pre-op. I had to park in the parking deck. And I parked beside this guy who had his door open. He obviously didn't want me to park beside him, but I did anyway. So I got out. I went in the hospital. It turns out I forgot paperwork. I had to go back to my truck, to this truck, and get some paperwork. Well, the way that I had parked is I parked very close to that guy in the truck who had his door open. So I was between his truck and one of these pillars holding up the parking deck. Normally I would go through the back door, the back driver's side door to get in, but there was a pillar in the way, so I had to go on his side to get in the truck, so he had to shut his door again. Man, did he get mad. Look, there's a parking space right there. We got lucky. But man, he was mad. He slammed his door. And I was just thinking, what I should have said is, man, you should try to deal with this every day. Then you'd have a reason to be mad. But it was just the whole deal was awkward. So next time we get in here, I'll be in the back seat with my crutches. See you in just a little bit. Hello. I feel like I'm gonna pass out.
No, you don't.
Not in a bad way, I'm saying like fall asleep. I gave blood for a blood test. I gave blood. And they're gonna see if I'm a diabetic.
Which would make a lot of sense.
Just waiting to go in now. I got my IV going. And I got my wristband. And this is to let everybody know that I'm allergic to latex.
He thinks.
No, I am. If somebody gave you a hard time about that stuff that you say you're allergic to.
That's different. I stopped breathing.
Well, I break out. I get hives from latex. I do.
It's okay.
You're laughing at me for making fun of me. Shame on you.
He's just a big baby, but I love him.
You're mean.
I'm not mean.
Alright, I'll see you guys when I'm done with this, hopefully. Hopefully y'all won't be too incapacitated to film. Hello everyone. Got out of surgery probably about an hour and a half ago. As far as I know, everything went well. What did the doctor say, Christina? What did he tell you?
He said that
You just told me.
everything went well, that he had to work the screw into your bone a little bit more than he expected because it was soft, but he said he got it in there good and secure, and that everything went good though.
I guess they didn't have any issues drilling through my bones.
Well, no, that's what he said they did.
My bones are too soft. Well, what causes that?
Different things. Probably just used.
I've been using it.
Not as nearly as much as you normally would.
Right now, my pain level on a scale from 0 to 10 is about a 9. 8, 9. I mean,
Is it declining?
I've been screaming and stuff, so it is as bad as I thought it was gonna be. But I'm just trying to pretend like it's not there, and it's not easy. They just gave me a Percocet, the kind that doesn't have Tylenol in it, which doesn't make any sense. I thought acetaminophen was supposed to make that stuff work better. They gave me probably 5 things of morphine after I got out of surgery. I just kept having to take it, I guess because I'm so big. And morphine, the thing about morphine is that it just, God, it'll make you so sick, especially if you haven't eaten anything. So, just letting you guys know I'm okay, and oh, I got a long road ahead of me. A lot of pain, but I'm a very determined individual, and the pain isn't new, so I'm gonna do this. I'm gonna do this for my family, and do this for my wife, because I love her very much, and she does so much for me. She fights for us, so I'm gonna fight for us.
You're gonna make me cry.
And I told her I'm in love with you, Christina. So in love with you. And that was something that popped into my head as soon as I was conscious. Is just, where's my Christina at? Where's my love?
You know, if morphine wasn't so bad for you, I want you to take it more often.
It's not the morphine.
I know, I'm just picking on you.
So I'll see you guys, I guess, when we get out of here.
See you.
Leaving DeKalb Medical now. Surgery is done. Oh my goodness, people. It was every bit as painful as I was afraid it would be. Just straight up sheer, just awful pain. It's going to be a long road to recovery, but I'm determined, and they did give me some good pain medicine to get through this, so I'm going to take it step by step. And yeah, so when we get home, I'll show you this some of the stuff that I have, which I've already shown it to you yesterday, but I'll actually have it hooked up to my leg and show you how it works and everything, make a video about that, and then that's pretty much it. There's a long road to recovery. Like I said, I'm going to be on crutches for a while, and the pain is just, it is awful. It's just downright awful. It's by far the worst surgery that I've had on my knee out of the 3. This is by far the worst. But we're gonna get through it. And there's a Porsche. I know that's random, but yeah, it's just there, so I had to get it. You know, I can't not mention a sports car whenever I see one, even if I am in pain. So yeah, I'll see you guys around. Be praying for me, be thinking about me, and thanks for watching. I'll see y'all. We'll see y'all later. Bye. Hello once again, everybody. Jared here with One of the Nation's Rage. It's been about 5 days since my surgery. Well, technically 6 if you count the day of. Sorry I took this long to get back with any of the video footage. This will be the end of the surgery video. But really I just wanted to get settled and get used to what I'm going to be doing for the next while. I did go to my post-op appointment yesterday, which the doctor removed the bandage, and they removed the the stitches in these arthroscopic incisions. There is a larger incision down there, not too big, not as big as this initial incision from the first surgery, but they did that because that was where they ran the replacement ligament through, and so I just kind of wanted to wait until they took the bandage off so I could show you. I've got 5 incisions. The 5th one still has stitches. They'll be taken out next week. And that's about it. But as you see, I told you I'd show you these devices that I have on me. These here, the compression devices, I don't have to use them as much anymore, but they're still pretty important, just because I'm going to be in bed a lot in the near future, and like I said, they just prevent blood clots from inactivity. Initially I think it had something to do with the anesthetic that they put me under with for my surgery, but I think you're just supposed to use these continuously throughout the recovery process to prevent blood clotting due to inactivity. And this here, the continuous passive motion machine that I've shown you, I'll show you it a little bit better now. Basically it's keeping my joint busy so that I don't have to, which prevents the joint from stiffening up. And I will say that it does work, it is effective, but it's not as effective as one would hope. My leg is still very stiff, very sore, and I definitely feel pain in my muscles, probably due to atrophy and whatnot, because I'm not using my muscles very much now. And I'll go ahead and show you, like right now, I'll give you a little close-up on the screen here. This does a lot of stuff, but they've only shown me how to use it in one way. I only need to use it in one way. It looks kind of complicating, but it's really not. As far as the way that I'm using it, it's really not complicating at all. You've got your speed on this side, which will speed up or slow down the movement, and then you've got your angle that you want the machine to be set at. Now I started out at 60, right now I'm at 80. I can actually go up to 90, and I'll show you here. Push this button here and bring it up, see it moving. I'm not going to go past 90 right now because that's where it really starts to get painful. So it'll actually come back up, and it will increase to a 90-degree angle, which will put my joint in a 90-degree angle, and you'll see it here.
Maybe I'll speed it up right here for this process to prevent the awkward silence.
So it shows you while it's moving what the angle's at. See it moving up, the numbers going up there. And That's 90. Ooh, yeah. That's 90, alright. I can feel every bit of it. So anyway, this is my life for a while until I get better. I am going to start physical therapy again next week. Not looking forward to it. I saw other patients in physical therapy that were going through the ACL reconstructive recovery process in physical therapy, and they were never happy. They always had a lot of pain. They were always the loudest ones there as far as reacting to the pain, the painful process of recovering. As far as I know, they manually move your leg to do this in physical therapy, and if they have to force it to keep it from stiffening up, they won't hesitate to do that. It's for your own good, but man, knock me out or something. That's all I got to say. That's why I'm trying to use this as much as I can right now to prevent them from having to impact and imply so much force when it comes time for them to do that. My quads are in a lot of pain right now, and like I said, I think it's just due to the inactive nature of this recovery. I do still have this. I've shown you this before. I'll show it to you again. Go ahead and show it to you again. This is the MP Phoenix. It is a neuromuscular stimulator. You strap it to your leg right there. It goes over your quad. It has electrodes on the inside, which you have to put these on, but you'll peel off the one side. It's got adhesive on both sides, but one side is meant to go onto. I'll go ahead and take it off. Hang on. Let me open this thing up here. Okay. That's what it looks like on the inside. Warning, attach 3 electrodes before use, or you will get electrocuted when you go to use this thing. These are the electrodes. Alright. They specifically come in packages of 3 electrodes. One big electrode for your muscles up here at your upper leg, and then 2 smaller ones for your quads down here. There's the electrode. Alright. This is the adhesive side that goes to the electrode, and this is what's going to make it safe to put this thing on your skin. And I would show you this on my leg. Hang on, I'll explain why I can't do that in a minute. Alright, that's the sticky side that goes to your skin. You can just apply this over your leg like that. Strap it down. Then you got this. It turns on. You can't really see it, but you would adjust the power setting, how strong you want it to be. This thing works very well. I've used it a lot in the past. I've had it for since last November. I've had it for a while. Last October, actually. So almost a year I've had this thing. I've been using it on and off. It's very effective, very comfortable, as comfortable as one of these things could be, I suppose. But that's going to keep your quads from getting the muscle atrophy, or if anything, it's going to reduce the risk or the amount of atrophy that you have in your quads. So that's what that's for. And like I said, I'd be using this thing right now, but I can't exactly put it on my leg right now because of these stitches. I won't do a close-up on that because it's kind of gross. Nobody wants to see that. But basically last night, my doctor told me yesterday to use this thing, so I put it on my leg last night, and it ended up tearing the scab off of my incision there, which bled a little bit. So I can't put it on my leg right now, just simply because of where that is. So I'm going to give this some more time to heal up, so it doesn't get infected and whatnot. Then I'll be using this on a daily basis, multiple times a day. So that's about it. That and well, as you can see there, lots and lots and lots of pain medicine. I'm not proud of the fact that I have to take this stuff. I'm not boasting about it at all, but you know, I'm thankful that I have something that I can take for the pain. That's what it's made for, and it's very useful, I'll say. You know, there's a lot of bad rap about narcotic painkillers, and they are abused, they are misused, they fall into the wrong hands, but they do serve an original purpose, and that's why they were created to begin with. And you know, I'm thankful that I have them right now to take. I don't want to be addicted to them or anything like that. Obviously, you know, taking them for a while, you're going to go through withdrawal coming off of them. I've already made a video about that on my channel, which I actually took down because of the negative attention that it was getting, the negative, I don't know how to say, it was just bringing in all this negative energy into my channel, so I took it down. It got a lot of attention. It was one of the highest viewed videos on my channel, and now it was actually the highest viewed video on my channel, but I took it down because that's not what I'm about, and I do not really care to bring that kind of focus in on my channel, and that my channel has nothing to do with that sort of thing. I'm just simply putting this all on here because I'm broadcasting myself onto YouTube. That's what my original intent was with my channel. That's what I'm doing. That's what I'm going to do. And so that's all that was about. And it was a mistake for me to upload that video originally. I apologize for anybody that may have been confused by it. But, you know, it's gone. And I will move on from here. I'll continue to make videos. Hopefully you guys continue to watch them and enjoy them. And I will see you again really soon. I don't know if I'll do another video about my knee specifically. I might talk about it. I might give you updates on how I'm doing. But yeah, I think I have enough videos about this particular thing in general. I have enough videos complaining about what I'm going through, and I really don't want to make any more videos about it. So it is what it is. You have the reference here. If you're someone who is going to have this surgery, here you go. I hope this gives you some information. I hope this gives you an idea of what the surgery itself is going to be like, what you're going to have to do when you start to recover from it. I guess I will talk a little bit about the pain and what to expect. Now, at the beginning of this video, this particular video, I was talking about, you know, the nervousness and just being a little scared to go through with this because of the nature of the surgery itself. the operation and what they actually have to do. Yes, they did have to drill into my bone, my femur. They did have to drill. I'll go ahead and turn this off. I've had it on for long enough, but I'll show you my hang on one second, bear with me. When you take this thing off of your leg, or when you get your leg off of this, you want to make sure that it goes all the way back down to 0. Then hit the stop button. And it'll stay at 0. Why is that important? Well, because you want it to be as flat as it can possibly be when you go to put your leg back on it and strap it in. Okay, so I'll go ahead and turn these off. Open this up, and I'll show you the biggest incision. Now, as far as incisions, this surgery is really not that big of a deal as long as they're able to do it arthroscopically and they're able to use a graft from a cadaver. Now, in a lot of cases, because as far as I know, the recovery process is actually better whenever they use a graft from your body. There's a greater chance of it working. There's a greater chance of you healing faster. But anyhow, in the case of them actually using an autograft that came from you, in most cases I assume that they would use it from the opposite knee. More than likely they would take a piece of your patellar tendon out, like I showed you at the beginning of this video, which obviously to do that they're going to have to make more incisions. You're going to have pain in your other knee, and it's just going to take more time. It's going to take time for this here to heal if they were to do that. So really I think the risk of just going ahead and using a graft from a cadaver is probably better for you, so that you don't have to experience so much pain, in which case would cause the recovery to be more excruciating than it's already going to be. But like I showed you at the beginning of this video, I went ahead and I showed you my incisions without all these bandages. But yeah, what I was saying is that yes, they had to, I'm not going to take it off, but they did have to drill through my tibia as well. If you noticed when my bandage was off, this bruising here, may not see it so well right now in this lighting, but that's just that's another discomfort, and it's just due to, from what I understand, it's just the fact that the blood rushes back in. I don't know exactly how it works, but it has to do with blood rushing back in to your muscles and your tissue and everything, and it causes it to bruise. I've got this huge bruise underneath this patch, and I even had some bruising on the inside here on the back of my knee. But that's it. I hope you got something out of this surgery video. I don't want to come off as discouraging. When it comes down to it, you can do this. I was actually a little relieved after it was all done, just to see that, you know, with a doctor that knows what he's doing, with medication that is very effective with the pain and managing the pain, and with all the equipment that they give you, all the equipment that they give you, you know, crutches and everything else, that it's doable, and you know, it's something that it's definitely worth doing to get better. And like any injury, it takes time to recover from. but all in all, it's doable. So don't be too nervous about it. Yes, it hurts, but it's gonna hurt more if you don't take care of it in the long run. You're gonna be compromised in your lifestyle. You're gonna be unable to do things that you need to do to survive in the long run if you're avoiding having this surgery done. So why not go ahead and face it and get it taken care of so that you can get better. And don't worry, I mean, I will have plenty of footage on my channel after the surgery as I improve, as my condition improves. I mean, and you'll see that I'm going to get better, and that it was worth it in the long run to go through with this. So, like I said, I hope this helps you. I hope you somewhat enjoyed it. I know it was a long and rather boring video, but it wasn't really meant to be entertaining. It was just meant to serve as a reference. And as I said, it's my life. I'm broadcasting it on YouTube. I hope you continue to watch and take care of yourselves. I'll see you next time.